Monty, I want to ask you about mental health
Mm.
and whether you feel that this huge rise in anxiety, depression, and a whole plethora of other mental health illnesses is related to our food environment and what we're eating.
I think that a lot of negative mental health outcomes that we are seeing in our modern society are likely linked to poor physical health, poor immunity, which is tightly linked to having a poor microbiome. And one of the biggest factors that you can use to change these things is the diet. So it's hard to directly prove causation in these things, but actually I think there is good evidence that if we change the culture about diet and the education about diet, and change the way we eat, the way we treat, the way we see our bodies, that should translate into better mental health generally.
And you talk about this this trifecta of our mind, our body, and our microbes in the book. When did you first realize that there was this relationship here? When was the first sort of light bulb moment that has led to this idea of, okay, maybe food can impact your microbes, that can impact your mental well-being, amongst a whole bunch of other health and wellness areas?
I think I first became really curious about the relationship between the mind and the immune system specifically when I was studying medicine and working as a junior doctor. And I know that whenever I get stressed, my eczema flares up. And in the immunology textbooks that I read about, so textbooks about the immune system, there was no mention of the mind or even the brain really. And in all of the psychiatry textbooks, there was no mention of the immune system whatsoever. So I found that quite curious. And I also found it very strange that at medical school we learnt about when you have, say, a paper cut, you have in the area of skin where there's damage, there are nerve cells that are activated, and there are immune cells that are activated to fight bacteria that might break through the skin.
Okay.
But what we've known for a long period of time is that nerve cells produce molecules that stimulate immune cells, and immune cells produce molecules that activate nerve cells to make pain, sort of increase pain in that area, if that makes sense. So the immune system, it's been known for a while that the immune system and the brain and the nervous system speak the same language.
Gotcha. They have this connection.
Yeah, but it's only been fairly recently that we've actually discovered the connection between them. I think a critical moment for this was in 2014, so exactly 10 years ago, when a team of researchers at the University of Virginia accidentally discovered a connection between the immune system and the brain. So for context, for most of modern medical history, it was assumed that the brain was completely immune privileged, was the word. So the immune system sort of stopped at the neck and dealt with microbial threats, of microscopic threats. But when it came to defense, the brain dealt with macro threats, large threats. So a lion or a fellow, or sort of an enemy tribesman trying to stab you with a spear or something like that. So that was the idea in terms of defense. But in 2014, a team from Jonathan Kipnis's lab at the University of Virginia were looking at the veins that drain the brains of rats. It's not the most sexy area of neurology. Most people focusing on the nerve cells in the brains, the neurons, but actually this team were looking at the the sewage system of the brain, because there's a fluid that's produced in the brain and it sort of comes out into the spinal cord and into the veins. But one of these researchers, someone called Antoine Louveau, was looking at the brains of one of these mice and saw a really neat line of immune cells lying right next to this vein that was sort of part of the brain. And it looked really odd. They were sort of queuing up very politely in midair, basically. He had no idea what was going on. So he applied a stain to look for lymphatic tissue. So lymph nodes or lymph vessels are basically the sort of the arteries and the veins for the immune system, basically. And when he applied this stain, it lit up in green, basically. He had discovered new anatomy. There was there's lymphatic vessels that connected the brain to the rest of the immune system. And for centuries, for decades before this, that anatomy had been there, but had only actually been discovered 10 years ago. And I think that was a pivotal moment because it led to lots of discoveries that actually there are immune cells. So the brain is surveyed by immune cells from the body. The skull has its own bone marrow that produces its own immune cells that look after the brain. And inside the brain as well, there are immune cells within the brain, these things called microglia. And they were assumed to be, I mean, glia literally means glue, and they were assumed to be sort of scaffolding that sort of held up the fancy neurons. But actually, we now know that these are immune cells that were donated by the immune system during the development of the embryo. And they went into the brain during the development of the embryo, and they've stayed there sort of ever since. And they can produce inflammation. They can clear up infections and things like that in the brain. And all of this is, in the last 10, 15 years, this is all brand new stuff. And it's actually beginning to show that the brain and the immune system is deeply interconnected and is part of, I believe it's part of the same system, which I call the defense system in the book.
I want to give listeners an idea of the magnitude of this discovery, because what you said to me is phenomenal, because it's almost like we've been staring at, I don't know, a garage, and we see the car in the garage, but we don't see all the other trinkets that collect in the garage, the tricycle in the corner, the spare tire. We've just been focused on the car, and we've ignored all the other supporting items that are around this garage. And I remember at med school thinking that the immune system stopped at the blood-brain barrier that I believe you described in the book as well. Like all the immune cells are circulating in the body, going around the lymph system, bone marrow, thymus, all that stuff, but nothing goes in the brain. And now what you're saying, and since this discovery in 2014, is actually our brain is littered full of these immune cells that are all providing not just a defense role, but they shape how we think and how we remember things. And you mentioned microglia. I wonder if we could talk a bit more about those folks as a supportive role beyond the defense.
Yeah, precisely. I mean, so microglia are, their one equivalent is like the Swiss Guard in the Vatican City, when which is quite a bizarre example, but they were in the sort of the early 1500s. The Swiss army donated these soldiers to look after the Pope, and they still do that to this day. So they still have to come from the Swiss army, but it's from a sort of completely separate place. But they're sort of in the Vatican. They're sort of protecting the Pope, and actually they're basically in microglia are sort of the only, or the key sort of immune cells that are in the brain. They don't sort of exist outside of the brain, but there is some evidence that they get early training when in the sort of developing fetus, developing child, from immune cells from outside the brain that can come in and can help sort of train them to sort of tell the difference between sort of things that are sort of self and non-self and things like that. And they often play a good physiological role. So what they do is they help sort of sculpt the brain. So we often think about when we develop from children to adults, that sort of new bits of the brain are sort of added on in a sense, but actually sort of it's the opposite. Instead of the brain being built like a sort of a Lego set, it's like a sculptor sculpting a sort of a figure out of marble, and the sculptors of the brain are microglia. So when there are nerves in the brain that aren't being used, there are these immune molecules called complement molecules which sort of lie across these nerves, and they're basically called eat me molecules. So they it's like sort of having like a really tasty sort of sugary snack, basically a bit of chocolate smeared on these nerve cells, and then the microglia come and eat them. But if the nerves are being used regularly, then they have a sort of a don't eat me signal on the top of them, and the microglia sort of avoid destroying those synapses, basically. So microglia are really important at sort of helping the developing brain. And when we talk about sort of neuroplasticity, the idea of nerves that fire together, wire together. And use it or lose it. The idea of the circuits that you use when you learn and develop. Actually, it's the microglia that are helping sort of sculpt the brain in that sense.
Gotcha.
But there is another side to them. So if there is persistent inflammation for whatever reason, if there is inflammation in the body that damages the blood-brain barrier, or infections in the brain, or lots of other different things, microglia can become hyperactive and can end up destroying cells in the brain. And there is emerging evidence to suggest that these inflammatory cells, as well as inflammatory molecules, may play a role in lots of different neurological and psychiatric conditions. And there's a lot of research that's going into looking at sort of dementia and Alzheimer's disease, and the idea that actually a lot of the damage, the proteins and the protein accumulation and damage that is sort of classical of things like Alzheimer's disease might be a consequence of prolonged inflammation, as well as a cause of the damage, if that makes sense.
Gotcha. Yeah.
So microglia have a sort of they're a double-edged sword, basically, along with the rest of the immune system. So inflammation is a good thing, and it's an adaptive thing in the short term. Like pain is a good thing in the short term. Stress is an adaptive thing in the short term. But when it becomes chronic, when it becomes long term, that's when the damage starts to wreak itself on the body.
I want to underline that point, actually, because I think that's a really important observation for people to understand, that stress is neither good nor bad. Inflammation is neither good nor bad. It just is. But where it becomes uncontrolled or out of balance, or homeostasis as we call it, that's where problems arise.
Yeah.
And I love this analogy of, actually, because I always thought in my mind, your brain is like a Lego kit. And as you progress, as you get older, you add new blocks and you build them into your brain. But what you're saying is the exact opposite. It's almost, we have a big block of marble, and the glia have these signals of chip me here, and that's how you prune, and don't chip me here because this is important. We're using that quite a bit. So this kind of lends itself toward trying to explore ways in which to stress or expand your playfulness in learning languages or sport or movement, so you can protect more of this precious marble block that you've got, such that your microglia don't come and chip them away. Is that?
Yeah, definitely. And I think I really like your use of the word play as well, and that's something that I also, playfulness and play, which I think is something that is key to the immune system and the brain. So the immune system, in a way, is sort of like a brain. There is communication with different immune cells across long distances across the body. There's memory of infections that have happened. It's sort of its own self-organizing system, and the brain's similar to that. And there's now a lot of evidence that they're linked together. But one thing about both of these systems is that they love to find out what's going on. They love to be. There's a reason why young people or adults generally like to try and do new things and to play and to explore and to learn new things, because the brain is trying to refine its model of the world, is trying to understand what's going on. And the immune system does the same. It wants to know what things that are coming into, say, for the gut, for example, what foods are good, what bacteria are good, what bacteria are potentially harmful. It needs sort of constant training, the immune system and the brain as well. And that's why I like the idea of playfulness. And I think when it comes to any kind of lifestyle choice, lifestyle intervention, whatever you want to call it, I think curiosity and playfulness needs to be at the heart of it, of diversity, whether it's to do with you're thinking about your mental health, whether it's about the kind of food that you're eating, whether it's the type of exercise that you're doing, the places that you're going to. Curiosity, playfulness, expansion, exploring, I think is really key, because actually that's what your immune system, that's what a healthy immune system, a healthy brain wants. The opposite of stress isn't complete tranquility. Space and time are constantly moving. We are made to move. We're made to test our environment, whether it's through our eyes in terms of working out what's going on, or it's for our immune cells in our gut, testing the microbes that are coming through it. It's and that sort of that idea of curiosity and playfulness is, I think you just need to have that in everything that you do, whether it's dietary or you consider it as sort of a quote unquote mental health intervention. If you're journaling or anything, it's the same thing.
Yeah, something that comes up for me as you're talking about that is this idea of playful challenges. So a playful challenge is, trying to introduce something new or perhaps seasonal onto your plate that week. Or another playful challenge is taking up dance instead of just going to the gym and running on a treadmill, for example. Or playful challenges going for a walk in a different forest environment, because we know that there are some benefits of forest bathing. The Japanese researchers have told us about for years. So there's all these different things that we can be doing to challenge our immune system, to challenge our resilience to stress, to challenge our physical body as well, so it can move and adapt and become more robust as we get older as well in particular. I want to bring this back down to inflammation and immunopsychiatry. Why don't we start off with what immunopsychiatry is? What is immunopsychiatry?
Sure. It's a very new field that explores the relationship between the mind and the immune system. It's also confusingly called psychoneuroimmunology, but basically
psychoneuroimmunology,
which sort of sounds fancier. But I quite like immunopsychiatry because it's a bit simpler. And it's a new field because we've only recently got the tools to explore, the scientific tools to explore this amazing connection between the immune system and the mind. So a lot of the research is looking at people with certain mental health conditions and thinking, actually, are some of these mental health conditions caused by the immune system, or does the immune system contribute to these mental health conditions? Therefore, if we identify the right people, can we treat these mental health conditions with the immune system? But then there's also the other direction as well. And there's a lot of interesting research showing that mental health can affect the immune system. And that's
the other
way around as well. So stress, for example, I think we all have an intuitive knowledge that stress ends up etching itself into the body and into our physical health. But we're now realizing that that is partially done by the immune system, and that the brain can remember inflammation and can restart inflammation. So a really interesting new study that sort of peeks behind the curtain of the relationship between the mind and the immune system, and how the brain remembers immunity and how the immune system listens to your thoughts. It was done by a team in 2021 led by Professor Azir Rolls. And basically they experimentally inflamed the bowels of mice and used this really sort of fancy new technique called chemogenetics, which I probably wouldn't be able to explain very well, but basically you can work out which neurons in the brain are being activated, exactly which neurons, by the inflammation. So they did that. So that was pretty cool in and of itself.
Yeah.
But what they did next was after the mice had completely recovered from the inflammation for about a month, the team then, using another technique, activated the neurons in the brain. They didn't inflame the bowel or anything like that. They just activated the brain. And in the same part of the body, the inflammation flared up again by activating the brain. So it's clear that the brain has a sort of map of inflammation in the body and the immune system in the body. But under specific circumstances, it's fascinating to see how this might relate to humans. The brain, the immune system sort of can communicate to the brain, and if the brain sort of activates certain parts of the immune system, then you can have inflammation without any external trigger. And there are some other studies that show that during acute stress, so in a very stressful situation, our sort of inflammatory markers increase in the blood. And then looking into this in more detail in animal models, they've worked out that some teams have worked out that the brain communicates to muscles. The muscles produce molecules that recruit immune cells from the bone marrow to fight an infection. So if thinking about, say, if you walked out of the studio later and onto the street, and you turn the corner, and there was in the middle distance was a hungry lion.
Okay.
And immediately as you clock it, your body goes into the fight and flight.
Yeah.
Fight or flight mode, in which we know all about in terms of adrenaline and things like that. But actually, the immune system's activated as well, and particularly bacterial elements of sort of antibacterial elements of the immune system.
Gotcha.
So for example, neutrophils are sort of taken out of their barracks in the bone marrow and out to the sort of the walls of the body and the skin
Right.
and the gut, assuming that if you're going to be attacked by a lion or whatever it is, that if the skin's breached and microbes come in, then you
Wow.
want to be able to fight those off.
So it's like a preemptive signal to your defense
Yeah.
that we're going to be in a fight.
Yeah.
And if we get cut, we would be ready to fight any pathogens that we can come into contact with.
Precisely.
So our bodies are that smart that we prime ourselves for not only a physical altercation, but a microbial altercation as well.
Yeah, exactly. That goes right to the crux of it, really. And that's why some researchers and why I definitely believe that the immune system and the mind are part of the same defense system.
Right.
So when you see a lion, it's not just your brain thinking, okay, am I gonna fight or am I gonna run away? Actually, the immune system the brain recruits the immune system to fight.
Gosh.
And then the opposite's also true. So when we're infected with a virus or a bacteria or whatever, most of the symptoms that we have are mental.
Yeah.
We end up, this is something called sickness behavior. You end up retreating from others. You end up feeling really depressed. You often, appetite changes. It can sort of decrease massively. You sort of just feel gross being around other people. And actually, other people, there's a lot of evidence to show that other people feel gross when they're around you as well, when you're infected. Yes. And there's probably an adaptive element to that.
Yeah. I can
and so
definitely attest
your,
to that.
Yeah.
Everyone wants to stay away from me when I look like, oh yeah.
Well, I mean, there've been some interesting studies on this. In Mats Lakanda, who is a researcher in Sweden, who I interviewed for the book, did a sweaty t-shirt study. So basically, people were brought in and they were asked to smell the t-shirts worn by. So one group was people who were healthy, and another group were people whose immune systems had been activated by a bit of bacteria.
Okay.
And probably unsurprisingly, the participants could even if they couldn't quite describe how, they could tell who'd been infected and who hadn't been infected. And
from smelling the sweat.
Yeah, just from smelling the sweat. And there have been studies that show that humans we're very exquisitely attuned to noticing human motion, so biological motion, and we can tell when people are sick by the way that they walk, even when it's not hugely obvious.
Right.
And the idea is that when someone's infected with a bacteria or a virus, it's hugely adaptive to rest and sort of conserve energy, because the immune system requires a lot of energy, but also potentially to remove yourself from the hurt from other people as well. And it makes sense for other people to be repelled from you for that period of time at least.
Yeah.
So we talked about the mind recruiting the immune system during stress. Well, the flip side of that is during infection, the immune system recruits the mind. So it's all part of the same system basically. And we're only just discovering the interconnectedness of this.
Well, it sounds like this is an evolutionary trait. I always like to think of things through what would evolution have designed us for. So we're optimizing for procreation, expansion, survival. And I guess it ticks all those boxes because you want to make sure you're not infecting the community that is responsible for your collective survival. You, as an individual, recognizing someone who is ill, you want that to be innate as well.
Yeah.
And you'd want to have that adaptive behavior whereby you actually rest and allow your body to fight off any pathogen that you're currently. Isn't it fascinating?
It's so fascinating. I mean, the implications are pretty huge. It was interesting when you were saying about procreation as well. There's some evidence to say that pregnant mothers are also more sensitive to various different things and actually become more judgmental of other people.
Really?
The idea being maybe trying to protect themselves from other people. And so there was this PhD thesis that I read last year that was really interesting that demonstrated that there is quite a big connection between people's aversion to certain smells. So if people have a heightened sense of disgust, basically, they're more likely to be more judgmental of other people. And more likely to be sort of biased against sort of out groups and people like that.
Wow.
And it's interesting to think about how the immune system and the effects of pandemics and sort of infections generally influence society in a way that we don't realize.
That is absolutely fascinating. In terms of the sweat and the aversion to other people.
Mm.
You've had first person experience of this, right? Because you, for the book, For the Good of Science, you actually willingly injected yourself with an endotoxin.
Yeah, for the book, I got injected with a typhoid fever vaccine, which is one of the most the vaccines that can produce one of the biggest sort of immune responses. And so that was bad enough. But actually, I willingly went to a brilliant team in Cardiff, led by Professor Neil Harrison, and asked to be injected with endotoxin, which is like quite an ominous sounding molecule, which is also called lipopolysaccharide, or LPS. And basically, it's a bit of a bacterial cell wall that is readily recognized by the immune system, and it kicks off the immune system basically very quickly.
So it triggers this cascade of all the immune cells being put on guard.
Precisely. And researchers have been able to get purified lipopolysaccharide or endotoxin, and they have to get it in sort of nanograms for it to be safe, because otherwise the immune system will go into massive overdrive and you go into septic shock.
Gotcha.
But but researchers are now giving patients, small sort of healthy participants, small amounts of this molecule and seeing what it does to the brain, seeing what it does to mental health. And what's really interesting is that in these sort of experimental studies, when people are given this immune stimulating molecule, not only do they tend to have symptoms of depression, but there's a lot of evidence that people's the way that they react to different rewards changes. So people become less likely to seek positive rewards, but conversely, they become more sensitive to punishment, in a sense. And the idea is that actually, if you get infected, even when the infection dies down, you can end up having these symptoms of low mood that can persist for long periods of time, because it can sort of not necessarily rewire your brain, but change the way that you perceive the world. But this links to studies looking at people with depression, a subgroup of people with depression, perhaps a quarter, which is still a very large number of people. It might be 70 million people worldwide who have high levels of inflammatory markers or slightly high levels of inflammatory markers in their blood. And some researchers are calling this inflamed depression. Another word for it is immunometabolic depression, because actually a lot of these people have different metabolic disturbances as well, because the immune system is tightly linked to that.
Yeah.
And there's ongoing research as to whether sort of anti-inflammatory treatments might be curative for some of these people. This is a really interesting area, because it was sort of first came to people's attention sort of in the early 2000s, when, funnily enough, it was in rheumatology clinics, so joint clinics, and sort of in the early 2000s, these new biologic drugs, these very targeted immune drugs, amazing drugs, for things like rheumatoid arthritis and psoriasis and things like that, were being brought out into the clinic. And lots of these specialists realized that there was a kind of a weird side effect in a lot of the patients, in that a lot of the patient's mood improved massively, even if the symptoms of, say, rheumatoid arthritis didn't improve. And then at the same time, there was liver doctors giving patients with hepatitis, which is a sort of a liver virus, an inflammatory molecule called interferon.
Yeah.
So they were actively inflaming these people. And about a third to half of the patients ended up getting depression. And a lot of these people, even when the treatment had ended up having depression. So the idea is that reducing inflammation in some people improves mood and reduces depression. And actively inflaming people can cause depression.
Wow.
So there's some early evidence and some bigger trials ongoing looking at anti-inflammatories in depression. But this also, there's a lot of research into new medications, but actually this has implications for anti-inflammatory lifestyle interventions as well.
Definitely, yeah. We'll get onto the anti-inflammatory lifestyle in a bit, but I want to just focus a little bit more on the persistent low-grade inflammation that can be triggered perhaps by an infection that's a bit more prolonged. I mean, the most recent example, which would be something like long COVID, but there are examples of things like Epstein-Barr virus. There are mold toxins as well that causes low-grade inflammation that people don't really know too much about at the moment. I certainly wasn't taught too much about that at medical school, but there appears to be some relationship with those sort of indolent infections with things like ME or chronic fatigue syndrome, or a whole bunch of other sort of areas that we don't actually know too much about with regards. But one of the dominant symptoms will be symptoms very similar to depression, low mood.
Definitely, that's a really interesting area, and reactivation of viruses that remain in the body is a really interesting area. There aren't many viruses that can sort of persistently survive in the body, and one of these families are called the herpes virus, among which you have the virus that causes shingles, which can reactivate at any time in life, but also Epstein-Barr virus, which sort of lives within certain immune cells and can just stay there dormant for years and years and years. I mean, most people have Epstein-Barr virus in their bodies. But for some people, sort of reactivation of these viruses by whatever cause can end up wreaking havoc in the body. There are lots of things that can cause this reactivation. So things like viruses, so the COVID pandemic, there is some evidence. I mean, things like long COVID, it's not just one condition; it's lots of different conditions. But there's evidence that viral infection can sort of reactivate these latent viruses, and that can cause prolonged inflammation. Stress as well can reactivate these viruses. I've myself had shingles during my preparation for my finals at med school, and there wasn't much of a change in my lifestyle, but it was the stress that reactivated what was initially the chickenpox virus that had sort of buried itself in one of the nerves in my back. And as you said, things like mold, things that we don't yet know about in our modern environment as well, that are increasing persistent low-grade inflammation that is likely to be having an influence on mind and body is a huge thing, and we're only just beginning to start to understand this whole area, which is why I think trying to focus on having an immune system, a mind, and a microbiome that can be sort of resilient to these stresses that exist in the environment is key.
Yeah.
So it's very interesting from a kind of a treatment point of view with new kinds of treatments, but also in terms of how we live our lives.
Yeah. Do you think there is a subset of people who naturally have low-grade inflammation that are more susceptible to depression for that reason as well?
That's a great question. There have been some studies called Mendelian randomization studies, which basically look at some people who tend to have genes that predispose you to having higher levels of inflammation or certain inflammatory molecules. And they do associate with an increased risk of having this sort of subset of inflamed depression. It's quite early research, but it's looking very interesting. And I think generally with a lot of these conditions, whether we call them physical or mental health conditions, because actually there's no mental health condition that isn't also physical.
Yeah.
There's no physical health condition that doesn't have a mental aspect to it as well. But for these conditions, it can be a multi-hit hypothesis in a sense. So you might have a genetic predisposition, but may never get this condition. But then you might have trauma, early life trauma, or PTSD, because there's a strong link between PTSD and developing things like autoimmune diseases and things like that. Infections, various different things, and lifestyle, sort of environmental lifestyle factors can sort of build up to the point where disease happens, sort of like filling up a cup. So we all come, say, with like a little bit of water in the cup, but then things like stress, very different kinds of stresses and trauma, or viral infections and things like that. And I think that a psychological stress and a viral stress do similar things to the body, because psychology is biology. It all does a similar thing. These things, if you keep adding these things to the cup, once it overflows, then you have chronic disease, basically.
Yeah.
So it's not necessarily, we like to think that there's one specific bad guy and one specific treatment for various things, and for some conditions there are, but often it's a combination of these things.
Yeah, and it's interesting, isn't it? Because I think most people would see inflammation as a bad thing, but actually rewind a few hundred years ago and it would have been seen as a very good thing. And I think there's a parallel with our like negativity bias, right? So that's why I sort of stopped listening to the news as much during the week, because you find your mind naturally attaching to the negativity in anything that you come across, whether it's in the newspaper or on the news. There is that sort of like low grade anxiety or panic, but that's actually a very important survival tool.
Yeah.
So going back to the example of the saber-toothed tiger that hopefully isn't down the road from the studio now, that would have been a very looking out for the tail behind the bins or whatever, like that would have kept me safe. In the same way, having that low grade inflammation would have kept me safe if I did cut myself and I needed to recruit my immune cells. So it's just navigating a modern world with this baggage from our evolutionary history.
That's fascinating. And I love the phrase of that negativity bias, because there's a negativity bias in humans. If anxiety had an adaptive role and still does, but often in our modern world isn't fitted to that necessarily. And that's related to lots of anxiety disorders, for example.
Yeah.
But actually the immune system has a sort of a negativity bias, sort of inflammatory bias.
Sure.
So there have been studies that have looked at the genetic material of people who had lived before the Black Death in England, during it and after it.
Okay.
And after big pandemics, you get changes in well, if you look at the survivors' genetics, they tend to have sort of more active immune systems and are more likely to develop inflammatory conditions like Crohn's and psoriasis and things like that. So actually, if you think about it from a survival point of view, it's better to assume something's dangerous when it's not than to not assume something's dangerous than it is. So there is that sort of negativity bias mentally and also immunologically.
Yeah.
Which is why things like actually sort of hypersensitivity, whether it's a sort of a psychological hypersensitivity to something, so trauma, or an immune hypersensitivity, autoimmune disease, there's a reason there's a huge overlap between autoimmune diseases and mental health conditions, because they're sort of, in one sense, they're kind of diseases of the same defense system.
Yeah.
And as you said, there is an adaptive reason for these things, but actually they can be sort of unmatched to the modern world. The kind of slow drip of terrible news all the time, of constant social media comparison to others, these sort of very abnormal, unhuman environmental factors that our brains and our immune systems are having to deal with.
Absolutely.
Cost of living crisis,
Yeah.
Rents, mortgages, things like that.
Yeah.
That kind of slow drip of stress can have the same effect on our bodies as it does when you're looking at a saber-toothed tiger, but all the time.
Yeah. In the knowledge of this being a very important factor when it comes to the likelihood of psychiatric conditions, I noticed in the book you talked about some studies that looked at previous history of autoimmune conditions and a latter diagnosis of a psychiatric illness like schizophrenia. And this appears to be mirrored across different countries in quite large cohorts. So the Danes, Taiwanese, I believe.
Well, yeah.
There's quite a few examples of this. What is the likelihood that we've actually got people with a psychiatric diagnosis that actually have inflammation at the core, the root of why they're ill in the first place?
Yeah, really interesting. There's, over the last 10, 15 years, we've realized that there are some people with severe mental health conditions, so psychotic conditions. So psychosis basically means it's a sort of a break of one's understanding of reality. So you end up giving too much significance to specific things. So you end up having visual or auditory hallucinations, or you end up having sort of delusional thoughts that are out of context with one's culture.
Yeah.
And a sort of chronic version of that is called schizophrenia. But there is evidence that some people with psychosis, actually it's caused by the immune system directly attacking the brain, antibodies directly attacking the brain. And when these people are treated with these with sort of treatments that we know about that remove antibodies, these people can make complete cures. Complete cures. This proportion of people with, say, psychotic disorders is probably relatively small. It's probably less than 10%. But I mean, that still means that there are probably people in most large psychiatric hospitals who are having medications that aren't working, and actually they have an autoimmune condition that could completely cure them. So that's quite a small subset of people. But then I think there's a larger group of people whose, as you mentioned, with sort of autoimmune conditions in the body, creating inflammation that can affect the blood-brain barrier, the brain, and can contribute to or cause mental health conditions that we kind of don't yet know about. And, we didn't know about these autoimmune psychosis conditions until very recently. And I think humility is key. We're likely to find out over the coming years, decades, that there are many mental health conditions, or things that we call mental health conditions, that are sort of full body conditions.
Gosh.
That can be directed by the immune system.
Yeah. And I'm just trying to bring ourselves back to the clinic here, because there must be a way to try and isolate people who fit that criteria. Maybe, not this, maybe not even just the people who can make a complete remission, but at least have some relief of their symptoms with an anti-inflammatory approach combined with all the other things, right? I'm not trying to discount that antipsychotics and antidepressants may have a role, but certainly the anti-inflammatory tools that we have at our disposal may also have a role. But there are probably things that we can investigate already using quite simple tests, right? So
yeah, definitely. I think you raise a really important point about these subgroups. So depression, for example, so major depressive disorder, often we can think about it as one condition, but actually the diagnostic criteria, you can end up having 227 different combinations of symptoms that can give you a diagnosis of depression. It's likely that there are different subsets of depression. Some people respond well to conventional antidepressants, many don't. Some respond well to more well to psychological therapies, and there is likely to be a proportion of people who will respond well to sort of immune-mediated therapies as well. And as you say, it's about identifying what works with who, basically. So it's the idea of stratified, personalized medicine, basically. So one area that some of my fellow colleagues at the University of Oxford are looking at are trying to work out sort of with psychosis, autoimmune psychosis, is working out what are the best ways of detecting this. So we have, the gold standard is by doing what's called it's a spinal tap, basically. So taking a bit of fluid from the spine, which is can be quite a difficult thing to do to get to properly diagnose this. But there are other blood tests that people are testing to see whether we can sort of work out, if you come into hopefully the ideal, and that we are working towards, with whether it's depression, psychosis, whatever, is that you come into a clinic and you have a blood test, you have a good diagnostic workup, and then the symptoms and the blood test, the inflammatory markers, as well as maybe the microbiome in the future as well, are combined to suggest that this person might have inflamed depression, or this person doesn't, and then that would direct them to the right kind of treatment. We're not there yet, but I think that's going to be. It's often said that it takes an average of 17 years for something to go from the lab bench to the clinic, often longer. But we're at a really exciting time where we're getting to see the start of this really interesting science, and hopefully big clinical changes are happening soon. There are some big studies looking into treatments for autoimmune psychosis or the subset of inflamed depression. A lot of those results are coming out over the next year or two. So it's a very exciting time for the field, basically. But I think it's something that you don't necessarily want to over medicalize. You want to focus on the people who would really benefit from the kind of the medical interventions. But then I think it's also something that we can all apply to our lives. This link between the immune system and the mind as well.
I'm going to push you on finding some tests that we have available today that may have some benefit, and just simple tests. I think what you said right at the start about actually taking a good clinical history and figuring out what their symptoms are, and figuring out if there is that overlap of, okay, this person's got type 2 diabetes, they're metabolically not healthy, they've also got these particular symptoms of depression. Perhaps that is pointing more in the direction of an inflamed subtype of depression, if we can call it that. But maybe there are some other things that can give just that extra granularity, not something that is diagnostic, but just generally pushing us in the right direction. So whether it's a blood test, whether it's some other investigation, or any things that do you think we could point people to? Yeah,
there are some blood tests that do tend to help categorize these different groups of people with certain conditions. So some very sort commonly used ones is an inflammatory marker blood test, something called there's something called CRP, and other inflammatory molecules like IL-6. They are blood tests that can be sort of routinely done. And I think the challenge at the moment, which I don't think we're necessarily that far away from, is identifying sort of what thresholds of these levels can we say, okay, if this CRP level is above 5, for example, does that mean that this person will respond better to an anti-inflammatory medication or not? So actually we have, I think we have the tests that are available basically. And what's quite exciting is that there are a few clinical trials going on at the moment. One of the people I interviewed, Brenda Pennings in Amsterdam, is looking at an anti-inflammatory medication in people with this group of, so that they have to have specific depression symptoms that are more kind of linked to chronic inflammation, and they have to have these blood markers as well, sort of over a certain threshold. And then when the results of these studies come out, then we could be more confident to say, actually, okay, we can probably move this into the clinic. So it's not necessarily like there's a big technological barrier in the way. It's just getting that kind of the data from these studies to show that these medications can work.
Yeah. You mentioned the interesting observations of the rheumatologists giving the monoclonal antibodies and these anti-inflammatory drugs, and then you've got I guess there'll be gastroenterologists giving the pro-inflammatory drugs. How is that being mediated? I remember in the book you talked about the amygdala. Perhaps we can talk to folks about what the amygdala is, this almond-shaped organ, part of the brain, and how that might be involved in the response.
Yeah, that's really interesting. There are bits of the brain that are tightly linked to various aspects of mental health, obviously. So the amygdala is sort of there you have these sort of two almond-shaped sort of lobes of the brain that are sort of they tend to be known as the kind of sort of the alarm system, fight or flight activators, which is one thing that they do. But the amygdala is also linked to an area of the brain called the insular cortex, which insular means island, but actually it's one of the best connected bits of the brain. It doesn't really make sense, but some really interesting studies are showing that this area of the brain is key for the brain to understand what's going on in the immune system in the body. And there's evidence that, so going back to the amygdala, that actually if inflammatory molecules go to the amygdala, they can basically activate it and basically create sort of fight or flight, anxiety, depression-like symptoms sort of in animal models. But also some evidence in humans that actually inflammation of these areas can sort of hypersensitize it from a sort of psychological point of view as well. And so it's likely that inflammation in the body can sort of inflammatory molecules, so the smaller molecules can get through to the brain via the blood-brain barrier, particularly if the blood-brain barrier is compromised or damaged in any way. But they can also interact with nerves. So there's something called the vagus nerve, which communicates lots of things to the brain, information to the brain. We assumed it was just things like sort of the gut generally and other organs and things like that, but actually it communicates information from immune cells in the body and immune organs like the spleen and things like that as well. So there are loads of modes of communicating information to the brain, and also lots of ways in which chronic inflammation in the body can sort of get into the brain and can damage the brain basically, and can change the way that we the brain works, and leading to sort of various different mental health conditions.
Because I think in my own sort of learnings and discovery of this topic, my idea was this highway between the brain and the gut and the brain and the rest of the body. But the way you describe it, it sounds very circular. It sounds very sort of it's in constant motion. It's not really like, oh, it's the M1. It doesn't go by. You don't just go up and down. It's literally like there's so many different connections going on. Is that how you see the?
Definitely. I think between sort of mind, body, and microbe, we're sort of like a wheel where one bit's body, one bit's mind, one bit's microbe, but a lot of it is sort of indistinguishable. And everything sort of ripples out and communicates with other bits of the brain. I mean, thinking about it from a sort of an adaptive point of view, there's this idea of redundancy. which means that the body has lots of different ways of communicating similar kinds of information. If one goes offline or whatever, one doesn't really work, then other ones can work, if that makes sense. So we there's a lot of evidence that nerves, specific small molecules, various different things can link the gut microbiome, the immune system, and the brain, and they're all communicating to each other. They're all speaking the same language. We're only just beginning to uncode this. I think it's fascinating that there are immune cells in the gut that can be activated by the brain, and we don't kind of yet know how that works. And they can cause inflammation when the brain's activated. We know that happens, but we don't quite yet know how this communication works. So I think it's this new science is really exciting, but I think it's something that should humble us as well. That actually there are these many links that we don't yet know about, and we are just only beginning to discover. But I think seeing yourself as a loop is key. It's if you one analogy I think of in terms of chronic disease, it is the idea of as a lid of a jam jar. You can't just apply pressure in one direction. You need to do it in two. So if it's like any kind of physical health condition or mental health condition, you need to recruit your body and your mind. People often feel that, understandably, that if you think about any sort of psychological aspect to a chronic, quote unquote, physical illness, then you're dismissing them, or something to do with their personality or something like that.
I definitely have experienced pushback of that in clinic, and and then also the other way, people can tend to sort of over psychologize things, but actually sort of psychology is biology, and it's all part of a similar thing. And it's tricky because it's in terms of understanding it, because we were taught as medical students. I guess I thought the way we were taught is that the body was designed to sort of house different nice neat systems that didn't talk to each other. It's like the body was designed to create different medical specialties. That's sort of how it feels. But actually, it's thinking about the different ways the body's adapted is survival is key. And why would you just have one bit of the body that is focused on surviving? And why wouldn't they be interlinked? I suffer from that hangover of how I was taught medicine, actually, of constantly thinking about different areas of the body, and even in the way like we discuss different topics on the podcast. I mean, everything always comes back to microbiota. The number of times gut health comes up on this pod is, it's always going to happen. But I think perhaps we could do a better job of connecting everything from the discussions we have around women's health, the discussions we have around heart health and the brain and everything else. I mean, it is very, very circular. And it reminds me of a quote actually that I wrote down from your book that I loved. It was it's from a Sufi mystic. The body is an instrument of the mind, and the mind is an instrument of the heart. And that for me really spoke to me after learning a bit more and reframing my idea about this whole system being circular rather than a back and forth arrow. Is there a reason why you added that? Was that something that you come across before and that it's finally made sense? Or
I first heard it at a lecture. I think it was related to a medical school, but not when I was a medic. And I just felt so. I can't quite remember who said it, but it felt like something completely new. It sort of jarred with the kind of the sort of traditional teaching that sort of the kind of the post-Enlightenment West generally in terms of medical teaching had come up with. There have been lots of brilliant advances medical advances by the post-Enlightenment West, but actually that's come at the expense of leaving the messiness of the human mind, psychology, emotions to one side, if that makes sense. And we're only just beginning to understand how actually subjects that to a lot of doctors and at medical schools and various things are seen as quite woolly, things like loneliness or, social oppression, things like that, are actually, they're biological. We are completely enmeshed biologically with our context, our environment, and all of our organs are, and they're all connected in that sense. In circular ways, not in sort of very straightforward ways necessarily. And what I'm really excited about is that actually we now have the scientific tools and instruments to be able to explore the relationship, not just between the mind and the immune system and the microbiome, but actually our environment generally, and how we perceive that, and how that affects us and how that affects others.
Yeah.
Yeah.
You mentioned loneliness. I wanted to ask you about loneliness actually. So I'm glad you brought it up, because I think a lot of people have heard about the harms of loneliness being as harmful as smoking. I think the US General Surgeon was talking about that a couple of years ago. And most people might think of loneliness as it's sad that people don't have support and love, but it's not necessarily related to physical illness. But everything that I've heard from today, and how the brain, and if you're not nourishing your brain with the social connections and environment, can have a direct impact on your immune system, that can have an impact on not just your ability to fight infection, but also heart health, metabolic health, etc. Sounds like it's going to be an important factor in prevention as well as management.
100%. It's really interesting. Actually, we, in our very atomized society, we either don't think about loneliness. We sometimes think about isolation and individualism as being quite empowering, or as you said, it's people who are lonely. We can think of, you can say it's sad, but it doesn't really affect you physically. But actually, the brain perceives social isolation, social rejection, loneliness as a threat to the body, a threat to the whole organism. And there have been studies showing that when people are socially rejected or isolated, the same bits of the brain are activated as than when you're experiencing physical pain.
Physical pain.
And also, actually, that's a similar part of the brain that is activated. It's called the insula, activated by infection as well. And there's not that much research into this, but I think there's a hugely interesting crossover between seemingly disparate threats to the body, so infections, inflammation, pain, and social rejection are sort of processed in similar ways, which is really interesting. So actually, loneliness is as physical as it is psychological and social.
Yeah.
As is various different kinds of structural oppression. It's very hard to measure, which is why people often don't kind of stay clear of these subjects, and can say, oh yeah, there are lots of confounding factors. If you're lonely, you're probably going to have a worse diet or whatever, and things like that. But it's all interconnected.
Yeah, and again, using that evolutionary lens, you want to regard loneliness, i.e., the lack of social cohesion or rejection, as high as an inflammation response, or as a physical threat. That sort of makes sense when you appreciate the lens of why we've been designed, to get to
definitely. Fostering community should be a public health intervention. It's really serious. We are made to be communal, to be social, in a similar way in which we need to be communal and social to the various bacteria or the various good bacteria that nourish our body and our brain. We need to be connected to different people. And the effects of a lack of that are physical as well as psychological and social. So actually, I think there is a huge sort of public health urgency for governments to focus on these sort of seemingly social, societal issues, and actually treating them as whole body, whole mind, whole society interventions. So and it's really exciting that the science is beginning to show that.
Because we can begin to give the attention to things like social isolation as much as we would do a pandemic. If it has the same threat to morbidity and mortality, then it should be given the same amount of attention and funds directed to it, etc. But it would take a lot of lateral thinking, I think, for any government to get around to that stage. But if the science underpins it, I think then you might see a turn. I wanted to talk about some of the case studies actually that you mentioned in your book, and I found these pretty phenomenal. And I think now, from everything that we've learned about the journey that you've taken us on, the immune system, inflammation, the mind, they kind of become understandable with this context, right? perhaps one that we could talk about is April Burrell, the person who was in a catatonic state for 20 years. This is phenomenal. Just a quick one. If you're enjoying this kind of content, you will love our free newsletter called Seasonal Sundays. It goes into depth on a seasonal ingredient every Sunday, and we talk about the nutritional medicine benefits, the research, and the culinary uses of an ingredient every Sunday with recipes included. You can get access to the free newsletter in the link just down below.
So this is a remarkable story that only makes sense in the context of the changes that have happened in the last 10 years. So in the late 90s, she was a 21-year-old promising accounting student from the US, and she started to develop symptoms of what we'd call psychosis, so hallucinations and delusions. And she was sort of had psychiatric assessments, and she didn't really respond to medications, the conventional psychiatric medications for psychosis. And she got worse and worse and worse until she entered a stage of catatonia. So that's basically where you have hugely reduced movement or words or facial expressions. And she would just sort of stand still, muttering nonsensically for hours, days, years on end, for almost 20 years. Gosh. And there was no treatment that worked for her until the late 2010s. So this is about sort of 5 or 6 years after the discovery of the links between the immune system and psychosis and mental health.
Right.
Where some people who had antibodies attacking the brain, when they were treated with medications that reduced these antibodies, they recovered. And so in the late 2010s, she had some of this treatment and completely recovered. So for 20 years, she lost 20 years of her life. And it's amazing to think, scary to think about the people living today, but particularly those in the past who have suffered horribly, for whom there could have been a treatment that was effective. And I think stories like this, and other stories of young people who end up having symptoms of psychosis and schizophrenia, where it's discovered that actually it's an autoimmune cause. I think this should spur us on to really work on identifying these people, working on treatments, because it makes a huge difference, obviously, to these individuals. And what's quite interesting, actually, is that the way in which the immune system sometimes attacks the brain and causes these conditions may explain why some dodgy treatments in the past continued. So that there's a reason why autoimmune psychosis tends to happen tends to occur in young women, and that's particularly because they can be caused by an ovarian teratoma. So what that basically is a tumor sort of in the ovaries, which tends to have that produces various different body parts within it. You can sometimes have bits of teeth, bits of various different organs and stuff like that. And the idea is that if there are bits of brain tissue in there, then the immune system attacks that, sees it as foreign, and then attacks the brain. In the past, people with young women with these symptoms, delusions, hallucinations, things like that, odd movements, would often be seen as demon-possessed, witches, things like that. And there was an idea of hysteria, which is the idea of a wandering uterus around the body, causing these, quote-unquote crazy women. Sometimes surgeons would cut out the uteruses of these women, and sometimes these women ended up being cured. But that's because they might have inadvertently taken out the tumor that was causing the autoimmune condition.
Gosh.
So these surgeries were sort of reinforcing the idea that, oh yes, it's the uterus in these women that is sort of moving around the body and causing these symptoms. But actually what they were doing was inadvertently curing an immune condition.
Wow.
Yeah. So there are lots of these women who have, and men as well, but they tend to be young people, autoimmune psychosis by these immune cells that attack the tumor and then attack the brain. With April Burrell, it was something slightly different. It's called neuropsychiatric lupus, but it's also an autoimmune condition where the body attacks various different cells around the body. It's one of the most confusing, complicated diseases in medicine, but it can also attack the brain as well. And that was what they discovered that was going on with April Burrell. Actually, it was. Yeah.
So did they give her high strength steroids? I'm assuming, is that how?
Yeah, so it's initially sort of high strength steroids, and then you can have something called IVIG, which is intravenous immunoglobulin. So basically, it sort of mops up the sort of rogue antibodies.
Yeah.
And for lots of these people, the sort of the combination treatment that's being tested now and tested by some of my colleagues in Oxford is a combination of this treatment that sort of mops up the antibodies, but also something called rituximab, which is a medication that basically acts against the immune cells that are kind of spewing out these antibodies as well. And that looks really promising. In lots of people, it's really effective.
Wow. Sidebar, is that where we get the word hysterectomy from?
Yes.
Gosh.
Yeah. Hysterical. Hysteria comes from the Greek word for
Wow.
uterus. Yeah.
I had no idea.
Yeah,
I had no idea about that.
yeah.
That is, that's crazy.
Yeah,
We're still using that word today.
Yeah.
With the connotations it had.
Yeah, and that's the thing. We're often sort of. I mean, medicine's done lots of wonderful things, obviously, but we're often working against sort of complex historical systemic issues when we're trying to make meaningful change. So it's and often we can't sort of, we're sort of swimming in history and these various different kinds of contexts and assumptions and things like that.
Yeah,
which is why a lot of the scientists that I've been privileged to interview for this book were basically mocked for their ideas about the gut microbiome affecting mental health and all these different things about the immune system affecting mental health and vice versa, in the sort of the 90s, the early noughties, and things like that. But actually, these people who've stuck at it are becoming vindicated, which is just very admirable for those people who are kind of swimming against a very strong current of assumptions.
I think I remember coming across the term psychoneuroimmunology a few years ago now, and just immediately thinking, that sounds like BS. I have no idea what that means. They've just bunched a whole bunch of words together, and there's no evidence for it whatsoever. And I can understand the skepticism of a lot of medics, because if you've come from a system where everything's in silo, why on earth would you bunch everything together? It just sounds like gibberish to sell a bunch of supplements and stuff. But now everything's being, validated. That isn't to say like everything out there should be validated, or, that there are definitely some erroneous actors out there. But I think it just speaks to how open-minded we need to be.
Yeah. Oh, definitely. And I think that's the importance of science, isn't real science, in terms of curiosity. It's not assuming anything, doing the work, doing the experiments, exploring the data and things like that, and not, understandably, medicine's a very conservative profession for understandable reasons, and you only want to be doing, rolling out big treatments when there's a lot of evidence for it. So it's a balance of sort of curiosity and optimism about these new connections, but not necessarily getting too carried away with them.
Yeah,
which is why I think we're at a really exciting juncture, because we are uncovering very exciting science and starting to begin to see how that could translate into the clinic.
Yeah.
So it gives a lot of hope.
Probiotics or psychobiotics, as John Cryer might refer to them as I know you've interviewed him for the book. What's your thoughts on those? How far away are we from probiotics having a positive effect, and whether we should be prescribing them? Because there's lots of stuff online that you'll find, smart biotics that are meant to be good for cognition and mental well-being and all that kind of stuff. But my personal opinion is that the science is evolving, and I don't think we can spot all particular strains. Yeah. But maybe you got some inside information.
I completely agree. I think it's an exciting field. There's nothing that would convince me in terms of the mental health arena. Nothing that would convince me yet that there are kind of specific strains that are clinically proven to treat depression or whatever like that. But that's not saying to say that actually very targeted probiotics, or sort of symbiotics, a combination of pre and probiotics, prebiotics being the sort of the food for the microbes, could be really useful in various physical and mental health conditions. And which is why I think, I know I completely agree with you, and I think in the more practical element of my book, which is relatively small compared to the rest of it, because a lot of it is looking at the science and then sort of tentatively looking at what the evidence base is for things that we can do with our physical health.
Yeah.
Which is why I focus more on diet, on plant-based fiber and fermented foods, things that are healthy, things that we know, triangulating through various sort of animal studies and human studies, are good for your gut microbiome and good for your health. And good for your health in lots of other ways. It's not just the gut microbiome. There's lots of other anti-inflammatory properties of various different kinds of plant foods, for example. Is a better place to start than pinning your hope on a sort of a silver bullet specific microbial strain. You know, you have trillions of microbes in your gut, and it's about the community. It's going back to thinking about cultivating a community rather than sort of just having one specific replacement or one kind of silver bullet cure, because actually it's about diversity is key. So actually how that works with specific probiotics is quite hard to see at the moment.
Yeah.
But I'm not ruling out the fact that, you know, there might be different probiotic strains that might be really useful for very specific conditions, because there are animal models that show that sort of probiotic various kinds of probiotics can be helpful for different kinds of health, but it's sort of waiting to see if that really affects humans in clinical studies.
Yeah, exactly. Yeah.
So I think so sort of a hope, but a sort of a kind of a hesitant hope.
As I'm attracted to the idea of being able to confidently say to people, these strains in this amount, in this dose, great, go for it. It's not going to do you harm. It might do you good. But for now, I just sort of refer back to fermented foods, diversity, basically doing what Mechkanov, is it Mechkanov?
Yes, was
doing in the 1900s.
I mean, he was 100 years ahead of his time.
Yeah.
Absolutely amazing, and was completely mocked for it. But yeah, no, I think it's I think that's the most sensible thing to do at this point. I mean, I can't necessarily speak outside of the mental health sphere for various different, say, gut conditions, but I don't yet know of specific probiotics that are kind of hugely effective in that.
Was Mechkanov the purveyor, would you say, of modern yogurts and probiotics?
He's an odd chap, an amazing guy. He got the, I think, 1908 Nobel Prize for immunology. So he was from Ukraine, and ended up going to various different universities and became across Europe at the sort of the turn of the 20th century, spending a lot of time, I think, with sea urchins in the Mediterranean. But basically he ended up discovering phagocytosis, which is the process of immune cells eating bad bacteria, basically.
Gotcha. Yeah.
So that's what he got the Nobel Prize for. But then after that, and years after that, towards the end of his life, he sort of kind of lived up to the sort of the mad professor hype and got obsessed about the sort of the elixir of life, the cure for aging, and he focused in on a bunch of Bulgarian peasants who had who basically seemed to live into their 90s or 100s, and they put it down to this yogurt that they would drink,
right,
sort of a natural yogurt. And he ended up drinking a lot of it himself and sort of going around sort of saying how good it was for his health. What was really interesting was, at the time, the idea of germ theory, the idea that disease can be caused by bacteria was taking over the world, which has been wonderful in lots of ways. But it was a sort of a kind of a war on bugs, basically. The idea that everyone thought that all bacteria must be bad. But he was sort of the first person to say, actually, maybe there's something in the bacteria in this yogurt that is providing some kind of physical and mental health benefits to these Bulgarian peasants. And unfortunately for him, basically, just after, a decade after he came up with these ideas, there was what was called the Spanish flu, the H1N1 pandemic, that killed a huge number of people. And then antibiotics were discovered, which was obviously great, but sort of furthered the idea that all bacteria are bad, basically. Right. So they kind of stopped the field of exploring good bacteria in the microbiome for decades and decades. Also sort of held back by the fact that we didn't have the technologies to properly
For sure.
look at bacteria. But he was. You can't often say that there are people who are sort of a century ahead of their time. So I'm a big fan of Eli Metchnikoff.
Yeah, me too. He should be. He should have his own brand of yogurt drinks.
Yes, I think there actually is.
Oh, is there?
I think in South Korea there is a brand of Eli Metchnikoff yogurt drinks, so they're ahead of the game.
Yeah, ahead of the game. I can't patent that one. You mentioned anti-inflammatory lifestyle. Let's dive into that, because this is the smaller section of the book. I really appreciate the science, because I think the science is complex and beautiful. The solutions are actually quite simple, which is why I think it's quite a short part of the book. The implementation of said solution, that's the hard stuff. It's getting into habits, getting into routines, making sure you're not going too hard, like with the onions and garlic in the first instance. So maybe we could talk a bit about diet. I know you've already talked about diversity and getting do you have probiotics every day? Do you ferment yourself?
I make my own sauerkraut.
Oh, really?
And I have experimented with kimchis, and
Nice.
I have kefir in the morning as well.
What's your recipe?
For sauerkraut.
Yeah, if it's not a closely guarded secret.
No, I mean, at the moment I'm doing a sort of red sauerkraut, which is basically just red cabbage and beetroot.
Okay.
But it's really good.
2% salt?
2% salt.
Okay.
Salt brine for things. I was also quite enjoy sea kraut, so getting a bit of different kinds of cabbage and seaweed as well.
Nice.
But I'm this is all very basic and very easy to do, and I'm not a good cook. I'm interested by the science, but
I mean, you try to cook pasta without water.
Yes. I should never have said that. these lies that were spread by my friends. But it's I've over the last sort of year or two, I've been sort of experimenting with different fermented foods, and it's really enjoyable, and it's really tasty. You just let the bacteria be your sous chefs.
Nice.
Just time and
how long do you put? So for the cabbage and the seaweed one, we're doing a podcast on seaweed soon, actually, to look through the benefits and those novel phytochemicals you find in seaweed, and we have so much of it in around the British Isles. It's incredible.
Yeah.
How long do you ferment it for? Like, are there particular times that you?
It varies massively, and it's I think it starts to. I mean, the longer you leave it, sort of the tastier it gets. But I can sort of leave it for a month, sort of 4 weeks to 6 weeks.
Okay.
And then it starts to get interesting.
Yeah.
But you need to you need to make sure you get the right percentage of salt and things like that. Just to make sure you aren't developing other sort of cultures of bad bacteria and things like that in there. But it's great. I think with fermenting, it's sort of I spoke to David Silver, who's the head of fermentation at Noma.
At Noma,
and he basically said, just start with something you really enjoy, whether you're just sort of like pickling chilies or something like that, or just create something that you just experiment with fermenting a food that you like and see what flavors come out of it. And it's something it's fun, it's exploratory, and it's good for your physical and mental health, and the process of it is really, really good.
Brilliant.
So what's really interesting though, I think, in terms of when you were mentioning, how hard it can be to implement all these lifestyle things, there's some very early studies that are quite exciting about the idea that if you get the diet right, maybe that might help with exercise. Because exercise is really hard to do. And I used to exercise loads in my teens, and that's one of the reasons why I didn't really worry about food, because I thought I was above it and didn't need to worry about what I was eating, because I was doing so much triathlon, running and swimming and stuff. But over the last 10 years, I've been trying to get back into sport, back into exercising. But whenever I have a sort of a New Year's resolution, I give up sort of halfway through January. I find it really hard with all the other stuff that I'm doing. But since I've started to sort of cultivate my microbiome using different kinds of plant foods and fermented foods, without realizing it, I began to sort of crave exercising and running. And then a study came out a couple of years ago from a team at the University of Pennsylvania, and they found that basically in mice, gut microbes cause runner's high. So they had about 200 genetically diverse mice, and they wanted to see how much they wanted to run for. So they were in a sort of cage where they could run, and also what their endurance was like when they had to run. And then they took loads of parameters, loads of blood tests, loads of genetic tests, microbiome tests, and they wanted to use machine learning models to sort of work out what were the best predictors of who would be the best exercises.
Yeah.
And it was actually the microbiome had a huge predictive power of working out, of predicting how much these mice would exercise and wanted to exercise. And they did a lot of very cool tests, and they worked out that some microorganisms produce these molecules which are they're called endocannabinoids. They're basically
Gotcha.
they're called enzymes that break down these endocannabinoids in the gut that activate receptors in the gut that spike dopamine when you're exercising. So why that's the case, why microbes want us to exercise more, or maybe it's probably a two-way thing. Maybe one theory is that it could be the brain uses the microbial diversity and the molecules coming from microbes as a sort of proxy for how well the body is being fueled basically. So it's like, okay, yeah, you can exercise more, or it also might be beneficial for the microbes to be able to explore more different environments and things like that. So it's a two-way thing.
Fascinating.
So the big thing is seeing whether, and there are some studies that I really want to see happen of exploring this in humans as well, which would be really, because if we can encourage people to have a healthy diet, that also helps initiate healthy exercise, then that would be a really good key into
Totally.
a lot of aspects of good health.
Absolutely.
So that's an exciting area. It's yet to be seen in humans. But
I've got the title for that paper. It's going to be called "Improve the Gut for Your Gains."
we should do this now before anyone else does. I think
that's brilliant. That's fab.
Yeah, so that's really exciting.
That is really exciting. I haven't come across that. I know it's in mice or whatever, but still, it's really, really interesting. Yeah. And what are the other big levers for reducing inflammation? So we talk about gut, fermented foods, diversity, exercise.
Moving to exercise. Yeah. I mean, I think we were talking earlier about sort of the idea of sort of stretch and not stress. The idea that actually short bursts of sort of short challenges, short bursts of exercise produce inflammation, but actually more exercise over the long run reduces inflammation. In the same way that if you are exposing your gut microbiome, as your immune system in your gut to different microbes, or if you are doing different things and doing different experiences in your life, generally from a kind of psychological, social point of view, you can become more resilient to various different things, if that makes sense. So the idea is that it's sort of training. So there's now quite a big body of evidence to suggest that exercise is good for your immune system, and there are some very cool molecular studies, or sort of very, very cool sort of in-depth studies that show that there are some cells in your bones that are mechanoreceptors. So basically they can detect movement and they can increase the production of good immune cells, just the kind of the actual process of movement.
Wow.
But exercise generally is very anti-inflammatory in the long run. So that's hugely important.
Yeah.
Sleep as well. There are some studies that this is a very early an area in its very early stages, but studies that show that if you have reduced sleep overnight, then the numbers of, say, natural killer cells, which are an immune cell that they can patrol for viruses, but also for cancers as well. Those numbers drop if you have sleep deprivation.
Gotcha.
I mean, I haven't spent a lot of time dwelling on those studies recently because I've got a 3 to 4 month old son at the moment. But I think that's something that people don't often talk about, is the fact that you can have all of these ideas for living healthily.
Absolutely.
But life happens, and I think it's about, if you see yourself as a community within you, there's a community within you, and you're within a community, and mind, body, microbe is a circle. Then if one of these areas isn't going to work out very well for the time being, so for me, sleep isn't realistically, I'm not going to be able to optimize my sleep, but actually leaning into meaning and purpose and love and connection and things like that. You know, if you can work on other things that can help your mind and your body at that time, then you don't need to necessarily become rigid and worried about not doing the right protocols and all this kind of stuff. Actually, it's sort of the mind and the body is inherently flexible, and I think cultivating flexibility in the way that you see the world and the way that you treat your body is so key, is so important. You know, having a baseline of habits and protocols and things like that can be really helpful, but actually being able to train, to play, to bend so you don't break is what we were made to do, basically. So I think it's key not to feel sort of bad that, you know, if you're not doing all these various different things, but it's kind of it's the journey. It's just it's having that awareness.
Yeah, and that in itself is something that can improve your immune system, having that good sense of perspective on the purpose behind why you do have poor sleep. It's because you're looking after your child and there is a greater meaning behind it, and that would perhaps hopefully array, perhaps not all of it, but allay some of the stresses of the poor sleep that you're experiencing, you know?
Definitely. And I think I think thinking about things in terms of vicious and virtuous cycles, or thinking about cycles instead of just, you know, treating your body like a machine, you know, like treating your body like a machine, you know, actually treating it as something far greater than that. And I think the idea of there's research into sort of awe and sort of being and feeling that you're part of something greater than yourself. You know, and there's, you know, you can look at that in terms of society, community, faith, all these different things, but actually also thinking about it in terms of how you treat the community of your body, or your immune system, your microbiome is hugely important as well. And I think, just as you said, having that perspective it's really important to cultivate that, because otherwise you can make things worse for yourself when life inevitably happens. You know, the body and the human body and the human mind is adapted to face regular changes, so daily changes and seasonal changes, but also to adapt to the horrendous chaos that life throws at humans. And I think, you know, resilience can be a word that's sort of banded around and can sort of, and can often be used by organizations to justify not looking after their employees sometimes, and just to have a little bit of resilience training. But actually, I think resilience is a really interesting concept, and I think actually thinking about biological resilience and psychological resilience are much more closely intertwined than we think. And that's why I think the immune mind link is a really nice way of seeing holistic medicine, but from a sort of an evidence-based way. So I think it's sort of a nice sort of microcosm of those connections.
I love that. That's fab. How I'm going to bring this interview to a close, because there's so much more I could talk to you about, but I'm really intrigued as to how you describe yourself to your patients. Like what is your specialty? How because I don't think when you were at med school I can't imagine you were going to be thinking about practicing medicine in a way that encompasses a holistic way of thinking, perspective, purpose, love, you know?
Gosh.
It's certainly not, that wasn't going to be my impression when I started anyway.
I mean, it's a tricky one in a sense. I mean, my title, I'm an academic clinical fellow, so I'm a 75% of the time I'm a doctor working in specializing in psychiatry in Oxford. 25% of the time I'm doing research, and it can be hard to sort of communicate the idea of, you know, when we're talking about the baggage of different of medicine, and the baggage of psychiatry, which is has had a checkered history, and is a very sort of rich but complex specialty. And I pivoted to, in terms of what career I've chosen to do. I spent a lot of after my initial junior doctor years, I wanted to do something to do with immunology, so dermatology or infectious disease or something like that. But then I pivoted into psychiatry because I found it to be a really rewarding specialty in lots of different ways, but also it's found the sort of immune mind connection really interesting. So I've only been in psychiatry for a couple of years yet. So I've sort of, in terms of how I communicate, how I sort of communicate what my role is to patients. I think it's key to. I think one of the luxuries actually of psychiatry is that, particularly community mental health, which I've done some jobs in that, is the ability to actually be able to listen to patients and to understand them as people embedded in their community. So it's not like, okay, that, what's the diagnosis? Your diagnosis. What's the medication that's going to sort of algorithmically treat this? It's actually what is happening in this person's life that's brought them into mental health services.
Yeah.
What are the things we can do to help this person that might not be medications? There might be medications. It might be various other lifestyle factors, various other types of support, various other liaison with other sort of physical health specialties and things like that. But it's tricky because then there's in the structure of the NHS, people go to one hospital for the body, another hospital for the mind. It's kind of it's people tend to get siloed, and there's no immediate solution for that. But that's what I hope, that medicine will become much more holistic in the future.
Yeah,
I think it inevitably will. But it's
and I think your work, your research, your book will hopefully be that bridge between the two, and actually encourage people, not just within psychiatry, but with the wider specialties of medicine, to be a lot more holistic in their thinking. But yeah, Monty, you're great. Honestly, you're absolute fab. I love all your books. You're a phenomenal writer. You're annoyingly good at telling history and regaling the science out of it, and it's really reignited my love for the science behind immunology and actually the inner workings of this magical system, and now thinking about it in a much more holistic sense about how much of an impact it can have on my mood, my digestion, my inflammation levels, my risk of disease. It's phenomenal. So congrats.
Thank you. I've absolutely loved it. And before this interview, I was slightly worried because I knew that you'd know all the studies from a previous interview with you. I'd know that you leave no stone unturned. But what has been so fantastic is thinking about everything that you're doing fits in wonderfully with all the new research that I've had the privilege of being able to look into over the last few years. So it's been an absolute pleasure. Thank you so much.
Fab. Pleasure's mine, man. Pleasure's mine. If you loved that episode, you will love the full library of podcasts from the Doctor's Kitchen Library. We talk about everything from inflammation, supplements, and food as medicine. Just like this episode right here. You can click it right now and check it out.